Well, hello class. This is Chad Wheeler.
And Ashley Kazare.
Okay, so we got privileged to do sensory and hidden impairments. So we're going to go ahead and talk about some of the impairments that we have found. So as you can see, we hope that this works on YouTube. So some of the impairments right here, I'll go ahead and let Ashley talk about this first one.
So first we have circulatory impairments. As you can see, some of the functioning characteristics are similar throughout the various levels of functionality. There's the first level, which has no symptoms that are present with any physical activity. And levels 2 and 3 are fairly similar with comfort at rest, but then as they do more activity or less activity, then there's signs of fatigue or pain. And level 4 is when there's discomfort during any sort of physical activity. And then down at the bottom, we have some intervention considerations. As a TRS, then a lot of the stuff you'll be doing is just kind of helping the client to monitor their own progress and so that they will be able to function on their own. But you'll want to be aware of any cardiac medications that could result in any activity contradictions. And you'll also want to be sure to assess the health status, fitness, and psychosocial support for the client.
Perfect. So I'm going to go ahead and I'm going to talk about another little one, and this one is the respiratory impairments. Some of the functioning characteristics of this talk about symptoms, and some of the symptoms may include permanent chest pains, and it talks about allergies and sinus trouble, as well as unexplained change in mucus color, some sleep patterns or weight gain or losing weight, some wheezing, some triggers that include are cold, dry air, pollen, dust, smoke, overheating, and high humidity. And some of the side effects through this respiratory impairment, they increased heart rate, high blood pressure. You can become very dizzy. You can have seizures, some hypertension, diabetes, and then just some experiences in like your growth. And then some intervention considerations. It says the TRS encourages warm up and cool down exercises. So this is us doing this stuff to help them out. And it also advises the clients on how to improve breath intake and breathing exercises and other practices so that the clients are taught self-efficiency concepts and problem solvings and a little bit of cognitive behavior therapy too.
Next, we have chronic fatigue syndrome. And these have various functioning characteristics as well that range from mild to two different severe levels. So, at the lowest level, then the person's mobile and you can do normal things. But as the impairment becomes more severe, then the client might have to use a wheelchair or they might be bedridden. Some possible symptoms that could be experienced by your clients are feelings of fever or chills, and they also might have headaches, depression, difficulty concentrating. Some intervention considerations to remember are that the TRS in this situation is mainly focused on helping the client to stay positive through use of humor, goal setting, and behavior cognitive therapy. And clients are also encouraged to develop self-management strategies so that they can know what their limits are without the help of the TRS. And some helpful activities to do with your clients could be Tai Chi, journaling, or guided imagery.
Perfect. So I'm going to go ahead and hopefully this works. Okay, chronic pain. So I'm going to talk about chronic pain. Some of the functioning characteristics. It says it may lead to activity, some weight gain, some insomnia, excuse me, and some fatigue, decreased concentration, and social isolation. And this may lead to some headaches, morning stiffness, and low back pain, especially in cold humidity. This also may cause loss of stamina, strength, and endurance, flexibility, confidence, and positive relationships. So, with some of these people, they experience all this stuff, and it's just hard for them to go through a lot of chronic pain. I know my mom, she has a little bit of chronic pain, and she talks about this lower back pain that hurts her really bad. And then living in Idaho with the cold and the heat, it hurts her. And so at the bottom part, it says the pain cycle continues as pain to perceive anxiety, and like the anxiety builds and muscle spasm cause more pain. So this absolutely hurts people that deal with chronic pain. But some of the considerations, the intervention considerations, is interventions can moderate anxiety and depression, and visual imagery and drama helps clients learn to refine their self-image. And then some of their goal settings and assigned projects between treatment sessions help clients maintain positive routines, a little bit of flexibility and stretching. I know with my mom's chronic pain, she visits a person to help her stretch her back out, and this helps her a lot. And it talks about a physician helping out. Also, there's some relaxation techniques like meditation. It relieves the tensions and manages pain. I know if we ended up doing a little bit of meditation, maybe we wouldn't have the pain in college.
All right, next up we have cancer. And some of the functioning characteristics, obviously, like these are going to differ with each client and with each case, but some common symptoms and stuff that everyone actually should watch out for is unusual bleeding, a lump in or under your skin, a change in the size or color of a wart, unhealing sores, change in bowel movements, chronic hoarseness with your throat, and chronic indigestion. And some responses that people will have with cancer include denial, anxiety, depression, and sometimes insomnia. And some of the treatments that are used and their side effects are surgery, which will affect the organ and system that's involved, radiation therapy, and there's some side effects that your client might suffer from, and chemotherapy, which has a decrease in white cells, bleeding episodes, and other side effects. So some intervention considerations to keep in mind are the importance of journaling and expressive therapies, because this can help your client to manage anger and redefine their self-concept. Guided imagery and muscle relaxation are really useful to help reduce anxiety in your client. And adventure or leisure experiences can foster problem solving and enhance self-esteem for your client.
Perfect. All right. So we also have some visual impairments, and I'm going to talk about some of the functioning characteristics as well as expand on some other stuff. But some possible behaviors is rocking, putting fists to their eyes, and leaning forward while walking. Some of the fitness you could do, just like lack of instruction may cause lowering fitness levels. We also talked about some of the daily activities and just some possible um, struggles that they have while using computers, driving, and other work-related aspects that help or that actually lower the employment rate and or loss and independence in people with visual impairments. Um, I know with like visual impairments, some of the stuff that uh, really go on with this is, it can be scary because you can't see with the visual impairments. Some of the intervention considerations that I want to point out here is, with the TS or with the TRS, it designs activities that will treat discernment techniques using other scenes, and then there's some sounds and echoes that help discern distance between objects, some light variations with natural versus artificial, and the odors help clients distinguish and remember their locations. And on the very bottom of this, just some of the stuff, it just says they use guide dogs or people that can enhance social interactions and make it easier to maneuver.
Next up, we have hearing losses. And some of the functioning characteristics for hearing losses includes possible behaviors of like a shuffling walk or restlessness. Sometimes they'll have unusual head tilts or rotations, and balance disorders are also common. And some of the possible health implications with this are social emotional consequences from those missed interactions that they might be unable to have. And anxiety and frustration are also prevalent due to the inability to access audible environmental information such as sirens. Some intervention considerations with clients with hearing losses is that it's really important to stand within the participant's view and to keep your lips fully visible. It's important for you to speak clearly, but make sure that they are able to see your lips, because they might be able to read lips as long as they can see them. And it's really important to lower the background noise when you're talking to them, and it's especially important that you speak to the participant and not to their interpreter. And as a TRS, we are supposed to encourage participants to lower their center of gravity and widen their base of support, because this will help them compensate for the unsteady balance that they might have. And using questions and requesting for a demonstration from your client will help determine the comprehension and ability that your client has with the techniques you're showing them.
See, I thought that this actually was interesting, just to go a little bit more in depth on the hearing loss. When I was 4 years old, I ended up getting some sets of tubes that didn't work for me, and ended up having 4 sets of tubes, and that's why it's hard for me to hear people, and that's why I talking to my doctor, I was wondering why I had such a low voice, but my low voice is for me to hear myself talk, and I just think that that's interesting when it comes to hearing losses. But I'll go ahead and talk about the dual sensory impairments. So bear with us, we're just about there. It's a big chapter, but some of the functioning characteristics are possible lost opportunity. This is isolation or unemployment can reduce social and intellectual opportunities. It's reduced physical activity can cause underdevelopment of self image. So, I mean, we talk about that as opportunities that these people have is like their self concept, and they have like an effect of the social environment help. Some alternative communications is finger spelling, and we'll also talk about the finger spelling or the TDD, and that's telecommunication device for the deaf. So that's pretty cool stuff. So intervention considerations is the TRS needs to establish a avenue of communication, and this is using techniques such as touch signs, spelling the alphabet on the client's hand, or having the client feel the TRS's face or mouth with their hand as the TRS speaks, and you got to follow a routine, and this is one of the main things. Is if you follow a routine, the client's going to know what to expect. So we strive not to change the routine for the client.
And last but certainly not least are communication impairments, which have significantly less information in the chapter. But some functioning characteristics for people with communication impairments include a lack of skills in reading, writing, or their attentiveness, and this can affect their ability to receive information. And they also might struggle to have the capacity to hear really low or really high tones, which is kind of like what Chad was talking about. And some intervention considerations to use with clients that have communication impairments is art, dance, music, and any movement type of therapy, because this will help enhance the participant's self-concept. But really, with communication impairments, there's not too much of a guideline because often these clients will have other impairments as well. So you'll use different interventions in accordance with the nature of communication impairments that your client has or any other impairments that they might have.
Awesome. Well, hopefully you enjoyed our little presentation, and we hope that you enjoy it on YouTube and it's not so shaky. And I think we had a good time, and we appreciate being in this class. Thanks.